Have you ever stopped to think about how small changes in your healthcare routine today can significantly improve your quality of life in the future? What if you could take control of your health before symptoms of a potential problem even appear? In this video, we'll discuss the 15 essential exams that everyone over 50 needs to know about. These tests aren't just about preventing diseases, they're about living a vibrant, energy-filled life and avoiding health surprises. Stay with us until the end, because exam 13 is one of the most crucial ones, and surprisingly, most people forget about it. Let's get started. Exam 1, General Checkup. A general checkup forms the foundation of any medical evaluation, especially for people over 50. It includes measuring blood pressure, weight, height, and calculating your body mass index, or BMI. These simple measures provide critical insights into your overall health. For instance, high blood pressure is a major risk factor for heart disease and stroke, while your BMI helps identify issues like obesity or malnutrition, conditions that can severely affect your quality of life. Even minor changes in these indicators can signal the need for more in-depth tests, such as those we'll discuss shortly. Don't underestimate the power of this routine exam. It's your first step in preventing bigger health problems. Exam 2, Complete Blood Count, or CBC. The complete blood count is one of the most essential tests for people over 50. It provides a detailed analysis of your red blood cells, white blood cells, and platelets. For example, low red blood cell levels could indicate anemia, causing fatigue and low energy. High white blood cell counts might signal an infection or issues with your immune system, which naturally weakens as you age. Platelet counts help assess your blood clotting ability. Too few platelets can increase bleeding risks, while too many may indicate conditions like thrombosis. Keeping up with CBC tests allows for early detection and treatment of underlying issues, helping you stay one step ahead in your health journey. Exam 3, Lipid Profile. A lipid profile assesses the levels of fats in your blood, including LDL, which is bad cholesterol, HDL, which is good cholesterol, and triglycerides. For people over 50, controlling these levels is crucial to prevent cardiovascular issues like heart attacks and strokes. Here's why it's important. LDL builds up in your artery walls, leading to blockages. HDL, on the other hand, helps remove excess cholesterol. Triglycerides, when too high, can increase the risk of heart disease. The alarming part? Most of these issues progress silently without noticeable symptoms. A lipid profile helps uncover problems early so you can make necessary lifestyle changes, like improving your diet and adding regular exercise. Exam 4, Fasting Glucose. The fasting glucose test measures your blood sugar levels after fasting for 8 to 12 hours. It's a simple but vital test for detecting type 2 diabetes or prediabetes, conditions that are increasingly common after 50. High blood sugar levels can indicate the early stages of diabetes, which, if untreated, can lead to complications like eye problems, known as retinopathy, kidney damage, referred to as nephropathy, and nerve damage, or neuropathy. By catching blood sugar issues early, you can make changes to your diet, increase physical activity, or begin medication to avoid long-term complications. Diabetes is manageable, but only if diagnosed in time. Exam 5, Renal Function Tests. Kidney health becomes increasingly important as you age. Renal function tests measure levels of creatinine, urea, and glomerular filtration rate, often called GFR, to check how well your kidneys are functioning. High creatinine levels can indicate that your kidneys aren't filtering waste properly. Urea levels reflect your body's ability to eliminate toxins. GFR, calculated using creatinine levels, age, and weight, is the most accurate way to assess kidney health. Kidney diseases often develop silently, so these tests are crucial for early detection and prevention. Staying hydrated, eating a balanced diet, and monitoring your kidney health are simple steps to preserve kidney function. Exam 6, Liver Function Tests. Your liver plays a vital role in detoxifying your body, producing proteins and metabolizing nutrients. After 50, it's crucial to monitor its health through liver function tests, which measure enzymes like ALT and AST, indicating inflammation or liver cell damage. Bilirubin, which can signal bile duct issues or jaundice. Albumin, a protein that reflects the liver's overall performance. Liver damage can result from years of alcohol consumption, medication use, or even infections. The good news? Early detection can help you reverse or control many conditions like fatty liver or hepatitis by adjusting your diet and lifestyle. Exam 7. Bone densitometry. Bone health is a common concern for those over 50. Bone densitometry measures bone mineral density, identifying osteopenia or osteoporosis, which increase the risk of fractures in the spine, hip, and wrists. Women, especially after menopause, are at higher risk due to reduced estrogen levels. However, men aren't immune. Smoking, excessive alcohol use, or certain health conditions can weaken bones. Early diagnosis through bone densitometry can lead to preventive measures like calcium and vitamin D supplements, medications to strengthen bones, and exercises to boost bone density. Strong bones are essential for maintaining mobility and independence in later life. Exam 8. Electrocardiogram or ECG and stress test. Heart health is another area that demands attention after 50. The ECG records your heart's electrical activity at rest, while the stress test evaluates your heart's performance under physical exertion. These exams detect arrhythmias, which are irregular heartbeats, ischemia, which is restricted blood flow to the heart, and early signs of heart disease. The stress test is particularly useful for identifying problems that don't show up during rest. Regular heart evaluations can prevent serious conditions like heart attacks and ensure a personalized treatment plan if needed. Exam 9. Vision tests. Eyesight often deteriorates with age, making regular eye exams essential for detecting issues like cataracts, which is the clouding of the lens, glaucoma, which involves optic nerve damage, and macular degeneration, which is the loss of central vision. For people with diabetes, diabetic retinopathy is another risk to monitor. Eye exams include visual acuity tests, pressure measurements, and detailed retina assessments. By catching problems early, you can prevent serious complications and maintain healthy vision for years to come. Exam 10. Audiometry. Hearing loss becomes increasingly common after 50, making audiometry an essential test for maintaining quality of life. This exam evaluates your hearing ability and detects early signs of hearing loss caused by natural aging, also known as presbycusis. Hearing loss impacts more than just communication. It can lead to social isolation, increased risk of depression, and cognitive decline, including conditions like dementia. Audiometry is a simple, non-invasive test. During the test, you'll listen to various tones and frequencies to determine your hearing range. Even mild hearing loss deserves attention, as it can worsen over time. Regular audiometry tests allow for early interventions, such as hearing aids, ensuring you stay connected and engaged in daily life. Exam 11. Colonoscopy. Colonoscopy is a critical test for anyone over 50, as it is the most effective way to detect colorectal cancer early. This type of cancer is one of the leading causes of death in this age group, but early detection can dramatically increase survival rates. Here's what a colonoscopy can detect: polyps, small growths that can turn cancerous if not removed, ulcers, and other abnormalities in the colon and rectum. The procedure involves a flexible tube with a camera that examines the colon in detail. While the preparation process might seem inconvenient, the benefits far outweigh the discomfort. For those with a family history of colorectal cancer or related conditions, starting screenings earlier than 50 may be recommended. Exam 12. Mammography for women. For women over 50, mammography is the primary tool for early detection of breast cancer, one of the most common cancers in this age group. This simple X-ray exam identifies changes in breast tissue, such as nodules, microcalcifications, and other anomalies invisible to the naked eye. Routine mammograms can detect breast cancer in its earliest stages, significantly increasing the chances of successful treatment. Women with higher risk factors, such as a family history of breast cancer, may need additional screenings. Self-exams and regular consultations with a breast specialist further enhance preventive care. Exam 13. Prostate exam for men. The prostate exam is a must for men over 50, as it's one of the most effective ways to detect prostate cancer early. This is the second most common cancer among men, and early diagnosis can make all the difference. The evaluation typically includes a PSA or prostate-specific antigen blood test, which detects protein levels produced by the prostate, and a digital rectal exam, which assesses the size and condition of the prostate. Although the rectal exam may cause some discomfort, it's quick and can save lives. Men with a family history of prostate cancer should start screenings even earlier. Regular follow-ups with a urologist ensure any concerns are addressed promptly. Exam 14. Vaccinations and Serologies. After 50, keeping your vaccinations up to date is vital, as the immune system becomes less efficient with age. Vaccines protect against serious infections, while serology tests check for immunity or active infections. Key vaccinations include the flu vaccine, taken annually to avoid complications from the influenza virus, the pneumonia vaccine, which prevents bacterial infections like pneumococcus, and the shingles vaccine, reducing the risk of painful outbreaks caused by the herpes zoster virus. Serologies, on the other hand, detect antibodies for diseases like hepatitis, HIV, and toxoplasmosis. They also identify the need for booster vaccines to ensure continued protection. Staying on top of these tests is an easy yet powerful way to safeguard your health. Exam 15. Lung function tests. Lung function tests, like spirometry and pulse oximetry, are essential for assessing respiratory health after 50. These tests help detect conditions such as chronic obstructive pulmonary disease or COPD, asthma, and chronic bronchitis. Spirometry measures the amount and speed of air you inhale and exhale, identifying problems with airflow. Meanwhile, pulse oximetry assesses oxygen levels in your blood, highlighting potential breathing issues. Smoking, environmental factors, and aging all take a toll on lung health. Detecting issues early allows for better management of symptoms and an improved quality of life. Simple lifestyle changes, such as quitting smoking and engaging in moderate physical activity, go a long way in preserving respiratory function. Exam 16. Neurological examination. As the nervous system ages, neurological exams become vital for identifying early signs of conditions like dementia, Alzheimer's disease, Parkinson's disease, and neuropathies. This comprehensive exam evaluates reflexes, muscle strength, balance and coordination, memory, and cognitive functions. Advanced tests such as MRI or CT scans can provide detailed insights into brain and spinal cord health. Early diagnosis of neurological conditions enables treatments that slow progression, improve symptoms, and support a better quality of life. Even seemingly minor issues like tremors or frequent falls should be investigated, as they may indicate underlying neurological problems. Taking care of your health after 50 isn't just about preventing diseases, it's about improving the quality of every moment you spend with loved ones. The 15 exams we've covered today are not just medical recommendations, they're your roadmap to a healthier, more fulfilling life. By staying proactive, scheduling routine exams, and addressing concerns early, you invest in a future filled with energy, vitality, and joy. Don't wait for symptoms to appear. Prevention is always the best strategy. Now that we've explored the 15 mandatory exams for people over 50, it's time to take action. The exams we've discussed are not just about addressing health problems, they are about creating a foundation for a long, vibrant, and fulfilling life. Preventive care empowers you to stay ahead of potential health issues. By scheduling regular checkups and tests, you can catch problems early, when they're easier to manage or even reverse. Remember, the goal isn't just to live longer, it's to live better, with energy and vitality to enjoy every moment. Here are some practical steps to help you stay consistent with your healthcare routine. Set reminders for annual checkups and routine exams. Apps or a simple calendar can help you track when each test is due. Build a strong relationship with a trusted healthcare professional who understands your medical history and concerns. Open communication is key to effective preventive care. While exams are essential, they're only part of the equation. Regular exercise, a balanced diet, and staying hydrated all contribute to better health outcomes. Knowledge is power. Stay updated on new health recommendations or advancements in screening methods to ensure you're getting the best care. Share what you've learned with friends and family. Encouraging them to prioritize their health creates a supportive environment for everyone. As mentioned earlier, Exam 13, the prostate exam for men, is one of the most overlooked yet essential screenings. Many men avoid it due to fear or discomfort, but this test has saved countless lives. Early detection of prostate cancer significantly improves survival rates and often allows for less invasive treatments. Similarly, for women, Exam 12, mammography, plays a comparable role in preventing and detecting breast cancer at its earliest stages. These two exams highlight the critical role of proactive care in reducing the impact of life-threatening diseases. Taking care of your health is more than just a medical responsibility, it's an act of self-love. By prioritizing these exams, you're not only protecting yourself but also ensuring more quality time with the people you love. Imagine a future where you can travel, enjoy hobbies, and participate fully in your family's milestones without being held back by preventable health issues. This is the gift you give yourself when you stay on top of your health. Don't keep this valuable information to yourself. Share it with friends, family, or anyone who could benefit from learning about these 15 essential exams. When more people understand the importance of proactive healthcare, the collective impact can lead to healthier, longer lives for everyone. Encourage others to take the first step, whether it's booking a general checkup or starting a conversation with their doctor about their health concerns. If you found this video helpful, make sure to subscribe to our channel for more valuable health tips. Leave a like to show your support. Turn on notifications so you never miss an update. Your health journey doesn't stop here. There's always more to learn and apply, and we're here to guide you every step of the way. Now that you're equipped with the knowledge of these 15 exams, don't delay. Book that appointment you've been putting off, organize your health checkups, and take charge of your well-being. Prevention is always better than cure. By acting now, you're not just taking care of your body, you're investing in a future filled with vitality, joy, and memorable moments with the ones you cherish most. Thank you for watching. Remember, health is the greatest wealth you can possess. With the right preventive care, you can enjoy every phase of life to the fullest. Stay tuned for our next video, where we'll share more insights to help you live a long, healthy, and vibrant life. Together, let's build a brighter and healthier future.